right. Well, good afternoon from Washington, D.C. Brandon Gare with the National Minority Equality Forum. I'm going to give a couple minutes for folks to join us. We had a ton of folks register that are very interested in this conversation on women's health during Women's History Month, no less. Before I introduce a couple of folks, I want to just go ahead and let you know some things how the webinar works. If you have any questions that you want our panelists to answer, please insert those questions in the Q&A box. If you have any comments, about it, or if there's any things you want folks to hear or learn about, please put that in the chat box. And so we'll address those as well as much as we can. Leading our conversation is our very own Mia Keys. I know this is a passion for her, not only in general as a relatively new mom and woman, obviously always been a woman, but a relatively new mom, and working at her company Hologic, which focuses on women's health issues. And so Mia has been doing this, working with us in NQF since seemingly the very beginning, but definitely since 2017, and is our perennial moderator and speaker. And especially when we have those tough conversations, she's always willing to take the lead and push the conversation forward. And so I want to thank her for that. And without further ado, I'd like to turn it over to her to lead the conversation.
Brandon, that was a lovely way to just start our conversation, and thank you so very much. I also offer hellos and thank yous and welcomes to everybody who are present both virtually right now live, but then also welcome to you all who are chiming in later on the NMQF YouTube channel. Thank you for coming. Happy Women's History Month. Happy International Women's Day. Happy Friday. And welcome. As Brendan mentioned, I'm Mia Keys, and I'm the Director of Government Affairs for Hologic Incorporated. We're a women's health and innovation company, but always I am a huge fan and supporter of everything NMQF does, and particularly with respect to conversations that, as Brendan mentioned, are difficult, but also uplifting and empowering and necessary. And so today we are joined by a really phenomenal panel of people, and I'm so very excited for the voice that these women carry, the work that they do, the spaces where they show up. And first and foremost, I'm just sending you all respect and warmth and admiration, because the work that you do is not easy, and yet you continue to do it. And so without further ado, I'm going to introduce each of them. And if you'd like to know more about each of the speakers today, you can just look to the chat box, either during this talk or after, and just learn a bit more. So we have with us today Dr. Yolanda Lawson, who serves as the current president of the National Medical Association. She's also the founder of Madewell OBGYN, which is a practice in Dallas, Texas. She's had quite the morning, and we look forward to hearing from Dr. Lawson. In addition to those roles, she is also the chair of the Board of Trustees for the NMA. She is a member of the American Congress of Obstetricians and Gynecologists, as well as the American Medical Association, the Texas Medical Association, and she is a delegate for the Dallas County Medical Society. Welcome, Dr. Lawson. We also have with us today Dr. Nadia Richardson, who is the founder and CEO of the Black Women's Mental Health Institute, which is a national health equity association located, founded, headquartered in historic Birmingham, Alabama. And in addition to being a mental health advocate, Dr. Richardson is also a diversity, equity, and inclusion consultant. Welcome, Nadia, Dr. Richardson. We also have with us today Ann Morris-Reed, who is the policy director of the Funders Forum on Accountable Health Project. She's also a lecturer in health policy and management at the Health Policy and Management Department of the Milken Institute School of Public Health at the George Washington University, which I'd be remiss if I didn't mention that I'm a current doctoral student there as well. And so for over a decade, Ms. Reed has been serving in just a range of senior level positions, whether it be policy or leadership position in leadership and executive branches of the federal government. She used to be the Deputy Chief of Staff and Counselor to the Secretary at HHS. She used to be Chief of Staff in the Senate, and also professional staff to the Energy and Commerce Committee. And we are so very happy to have your voice represented today. And then certainly last but not least, we have Millicent Gorham, and for all of you who work in the women's health space, who have worked in the medical space, you know this name. If you certainly don't know her work, you at least know her name. She currently serves as the CEO of the Alliance for Women's Health and Prevention. and which is a new 501c3 nonprofit, which primarily focuses on advancing the policies related to women's health and to girls' health, preventative health care in particular. And she is also the former executive director of Movement is Life. And for nearly 30 years, she served as the executive director of the National Black Nurses Association, which is, in that capacity, I came to know her some time ago. And before we get into the conversation, I just have to say each of these women are near and dear to me in terms of, like I said, just the work, not only just the work that they do, but who they are. If they're not a dear friend, they're someone I consider a mentor, I've worked with, or I look forward to working with. And so let's just go ahead and jump into the conversation. All right. And I want to know, how are you all doing? What does this Friday feel like? What's this season like for you? I'll start with you, Nadia.
Well, and this is going to work its way into our conversation. I am tragically optimistic, which I feel like you have to be to work in the space of health equity and to advance the wellness of Black women. But I'm also a little fatigued. Yesterday, I sat and listened to some House debates in regards to an anti-DEI bill that went through in our state. And that's exhausting, right? And to really understand the impact that that's going to have on institutions and education, ultimately our healthcare force here, it's exhausting. But I will tell you what's going to give me energy is each one of you and this space of having this conversation.
I'm so glad to be there in that way for you and for your work and by extension all of the people who are impacted by the things that you do and uplift. Millicent, same question to you. How are you doing?
Thank you, Mia. Well, I am slap happy. So, Mia, I just celebrated on March 1st my first anniversary as CEO of the Alliance for Women's Health and Prevention. Thank you so much, of which we are advancing policies for women and girls' preventive healthcare services. I did last week a 4.5 hour satellite media tour across the country on our new obesity campaign. Next week, I'll be doing some work relating to, everybody should know by now that Oprah's going to be doing a segment on obesity care, in which we are also hoping to follow up with that and get some more information out about obesity care and treatment. So right now, I'm in a real good space.
I'm glad to hear that, Millicent. Thank you. Anne, tell us how you are, please.
Well, good afternoon, everyone, and good morning to folks that are joining us from out west. I'm in a season, I would say, of balance. So going back to what Nadia said, I think I agree. It is exhausting. Everything is exhausting. But there's also so much opportunity, and I'm invigorated. And I think one of the things that I'm really trying to do to stay in the fight is take care of myself. And prioritize my own physical and mental health. I'm actually running a 10K tomorrow. It's the first race that I have run since I became a mother almost 11 years ago.
Oh, wonderful.
So, I think that this season of my life is giving me an opportunity to be there for my family in a way that I haven't at various points in my career, to really do some rewarding and meaningful and interesting work at GW to help shape and teach the next generation of public health leaders. So balance.
I love everything that all of you are saying. And certainly, last but not least, Dr. Lawson, you have had quite the morning. Why don't you please tell us what's going on in your world?
So I endorse everything everyone says. I'm feeling exhausted. I try to achieve balance, however difficult that is. It seems elusive, but I'm still trying. And I'm trying to maintain my optimism, but I am inspired whenever there's glimmers of hope. There's a lot going on in this country, and there's a lot that's affecting women broadly and wholly. And that piece for me is exhausting. I think we could all agree that there are some policy frameworks out there that long term I have quite a concern about, and it's about the long lasting impacts of those. And so I think we have to all remain inspired, all of us remain committed, and that is what drives is the commitment and this inspiration to keep doing the work, because I'm inspired by our communities.
I think each of you captured it so very well, and I'm sure our audience members can certainly understand and also endorse what you all have mentioned. We go through so much within a day, certainly moment to moment, and we might be feeling balanced, happy, inspired, tired, dejected, and irrespective of that, the work remains, right? And so when it comes especially to women, we carry all of that in addition to the things that we have to do. And so all of that also tends to wear on our bodies in an extremely unique way, and especially for Black women, it looks quite unique. And so this is a question for each of you. What are, some of those greatest health challenges facing Black women, in addition to the fact that we certainly, reinvigorate ourselves or reapportion our energies so that we can show up in the ways that we have to. And I'll give that question to you first, Anne.
Well, thank you for that question. I think it's such an important one. So I think to step back before I name any specific issue, I think it's really important that we ground the conversation understanding the drivers, right? The broader forces that impact our health and our ability to thrive. And so, the framework that's often talked about is the social drivers of health. And so we start with healthcare access and quality. We talk about your built environment. We talk about your social networks. We talk about your education, and we talk about your economic stability. It's important to remember that 80% of our health outcomes, by some estimates, are due to these drivers, these influences, and not what's happening in a doctor's or nurse's office. So I think that's really important to remember. It's also important to remember that most of what's driving this, even within that framework of 5, it's the socioeconomic factors. So having said that, from an issue perspective, and I know we have experts here in maternal health and in mental health and substance use and in obesity, but I think all those issues are really important and critical issues for our community to grapple with. I also would put cardiovascular disease and diabetes on the table as things that are really important for women, but fundamentally, there's so much interconnectedness in risk factors for many of these diseases, as well as the systems above us that are making it easier or harder to achieve optimal health. And I would also just call out, in the framework of maternal health, the intersection, the reproductive justice angle to this, which has been compounded by overturning Roe v. Wade. So to me, those are the big and pressing challenges and issues for us as a community.
I think that dovetails well, and I truly appreciate you uplifting the intersectional nature of really meeting our health challenges, and particularly from a social determinants perspective, as you mentioned, and political determinants as well. And so I'm wondering, Nadia, if you can expound on that. How would you meet Anne's answer there, and what's going on in terms of the work that you do?
Sure. Well, first of all, I would definitely express my appreciation for you grounding the conversation in that way, because it really does, the disparities that we're experiencing do lend itself to social determinants of health and political determinants of health. Shout out Daniel Dawes.
Shout out Daniel Dawes, absolutely.
Right. And I think maybe it's because, these conversations and things were going on yesterday with the anti-DEI bill. And because I'm an interdisciplinary professor, right? So I have the opportunity to teach with School of Medicine, School of Public Health, Biomedical Sciences, School of Health Professions. So either with students who are pre-med, in the medical school, or in their residency. And even though these DEI bills have a caveat that says that, if you're working towards a health profession or any kind of clinical aspirations, you can talk about equity and you can talk about DEI. if we're just addressing it at that graduate level, we're addressing it too late. They need to be introduced to these concepts in an undergraduate level, and these bills are stripping the ability for universities to do that. So I'm very concerned. I am concerned that when I teach with medical students, they don't know about the disparities. They don't know how they're connected to remnants of Jim Crow and remnants of women's rights and remnants of LGBTQIA plus rights. They don't understand these things because they haven't been introduced to the base level foundational historical roots of it. I do appreciate individuals like Uche Blackstock. Her book on legacy and racism in medicine, I think, is doing phenomenal things, but that is only brought into the classroom by professors who believe that there's importance to that. And I will say, without listing any names or any institutions, that I was in a room with tenured faculty over a decade ago who were using some of the same language we're hearing now. You know, you're trying to indoctrinate students with your liberal ideologies. But the thing is, students need to understand the foundational roots of health disparities and systemic racism, sexism, classism, what have you, because they have direct impact on health disparities. So when I'm thinking about one of the pressing issues for all of these things, I really am thinking about clinicians, politicians, university administrators understanding that if they don't kind of push back against these things, they're leaving future clinicians ill-equipped to provide the culturally responsive care that can counter some of those health disparities that we see every day.
I think that's well said, and it really helps to really bring Dr. Lawson's perspective here. You know, Dr. Lawson, when you think of the greatest health challenges for Black women, as a clinician, as someone who is also quite an advocate, politically involved, you lead up the most significant and largest representation of Black providers in the United States. What does that question mean for you?
Thank you. Thank you for the question. And I could not agree more than my colleagues here. So one of my pillars for this presidential year for me is around the Black women's health agenda. So one of those top is cardiovascular disease. And I think Ann just mentioned that. When you look at 59% of Black women over the age of 20 have some form of cardiovascular disease, we have to really, really understand what that means. And so you think about chronicity of disease, and when you've lived with disease a long time, that's going to mean, and for me, that equates to premature death, right? So many times from a physician's perspective, we're looking at premature death and preventable death. And so for, you know, when you talk about these conversations, it is exhausting, it's overwhelming, because when you look at the work that we have to do, these numbers are staggering. Black people as a whole, we die disproportionately more often. Our cancer death rates are higher than any other racial group in the United States. So while Black women may be diagnosed with breast cancer at a similar rate as white women and others, we have a 41% more higher likelihood of dying from it. And so for me, the conversations, I'm working right now on a new deck around women's health inequities and disparities. So women as a whole in this country don't fare as well. And so I think if we begin to elevate that conversation, when I'm going out and I'm talking about maternal health, people need to understand women as a whole in the US fare worse. And then there's a bigger, even larger disparity when it comes to Black women. And so I think these are important nuances. We have to frame these conversations, because the message bites that people walk away is just that Black women die more common, Black women die. But there is an emotional psyche to over and over hearing that, right? And so we have to frame this where we get more buy-in. And then I think Ann mentioned also reproductive health. Here I am, a Black female OBGYN in the South and in Texas at that. Immense challenges. And so while we know right now some of the policies are impact and what those challenges are, right? I mean, when you see women who are fearful to go seek care, risk their lives, just recently, one of my colleagues, their niece, 4 children at home, had a miscarriage at home, afraid to seek care, afraid, right, that there may be legal ramifications for a simple miscarriage, and she died from sepsis. and left 4 orphan children. So when you are in this work and you see this day for day, for me, I have a sense of urgency. You may feel that for me. I have a sense of urgency around this, the framework and how things are discussed in media. We have to enhance our framing of this so people understand this isn't just a small segment of people this is impacting. But when they understand the bigger whole around this, I really am I'm ambitious around this and optimistic that we can really create some positive changes that protect life. That's my primary interest.
And that is very well received in this space. But it is not an easy task, nor is it an easy conversation to even bring up for people. But your point is well taken. It has to be something that everyone has buy-in around. And Millicent, you represent the Alliance for Women's Health and Prevention, which I know certainly elevates the health statuses of Black and Brown women, but it is a national women's focused organization. What do you think are some of the greatest health challenges for women and for Black women in particular?
Let me start off by saying, let me put it in the context of the mission for the Alliance for Women's Health and Prevention, which again is around preventive healthcare services for women. We're advocating for policies that impact the well-being of women from a preventive point of view. And within that construct, we have 4 pillars. Addressing the upstream social and environmental factors. And I too am going to give a shout out to our friend Daniel Dawes, who knocks it out of the box every time. We are all smiling when we mention his name, we are all smiling. And then the second one is promoting early detection and diagnosis. The third pillar is advancing vaccine access and affordability. And the fourth one is advancing access to care and treatment, which is the one where I'm putting the rubric of obesity under advancing care and treatment. That's right now a major focus for the Alliance for Women's Health and Prevention. So everything that my 3 colleagues have mentioned intersects with obesity. As a chronic disease, we all know that obesity is a chronic disease. And if you didn't know that, I'm telling that to you right now, that obesity is a chronic disease, no different than high blood pressure, no different than diabetes. And we need to treat obesity as such. For Brown and Black women, 1 out of 3 adult women in the United States is living with obesity. 57% of African American women are living with obesity, and 44% of Latino women are living with obesity. So when we talk about mental health, when we talk about maternal health care, when we talk about cardiovascular health care, all of those are directly associated with obesity. Obesity is directly related to over 200 diseases, conditions, of which 13 of them are related to cancer. And so we want to have some conversation around obesity and all of that, what it all portends for women in terms of their physical well-being, their social well-being, and their financial well-being. What we have found is that in relationship to obesity, that the finances of women are directly impacted. So we're talking about the impact of women who are living with obesity are making 20% less than their colleagues who are not living with obesity. So that has a direct relationship to their social well-being as well as their physical well-being and their families and communities. And so when we're looking at it from a standpoint of stigma and of bias, all of these things have a direct relationship to all of the other chronic diseases. So if we can hopefully stem obesity and being overweight, then hopefully it will lend towards stemming the other chronic diseases that women are living with. What the Alliance for Women's Health and Prevention did 2 weeks ago was to launch its Everybody Covered campaign. And it is a campaign for women to be educated about their obesity, about living with obesity, that there should not be any shame, there should not be any bias, there should not be any stigma, that they need to understand that they need help. And yes, help to make sure that they can get the full continuum of comprehensive obesity care. So that's what we're looking to do with that campaign. We want to make sure that the women are educated and then have crucial conversations with their employers, with policymakers, with elected officials about getting comprehensive obesity care. And I can talk a little bit more about that a little later.
You know, what I hear, my apologies, Dr. Lawson, please jump in.
No, you about to say what I was going to ask, but no, go ahead.
No, ma'am, after you.
So I think that she just brought up an important point when you said bring it up to your employers. I think that is a very unique approach, actually, because I don't think that most people would do that, but there is power in that. And I think we really should explore what that looks like in this day and age. And I'm sure my DEI colleagues would agree with me when, and especially I'm in a state where things such as that can be litigated. But I think that's a really interesting point. I'm so glad to hear you say that, but I think it's great that we can provide maybe some guidance to individuals about how do you talk to your employer about that and what that looks like.
And I think as we're trying to empower individuals to talk to their employers, there's a lot of work that needs to be done to equip the employers to work through their own bias so that they can create an inclusive and safe space for people to come to them with their concerns. Because I have seen it in a space where individuals did go, and because the leadership wasn't prepared and equipped to be able to manage and create the supports that individual needed, it didn't work out well. So I would say that from a DEI perspective, that yes, empower individuals to tap into the resources that they are legally allowed to have, but make sure that their employers don't trip over their own bias in regards to providing those supports.
Mia, that's pretty exciting to me. I have 2 more people I can go to get some advice.
Listen, I hear that. I hear that all the way. And I really appreciate you all offering the audience examples of how to really help employees to empower them. And the other point I heard all of you saying to some degree is, you know, we all have a level of bias. The problem is when the bias is activated and it becomes harmful, right? And so I'm hoping that we can also keep that thread in mind when talking about not just the challenges, but also, you know, this is really my next question for all of you. You know, what are those promising opportunities to actually address the issues that each of you have elevated? You know, what works, what still works, but is on the verge of being defunded or deactivated because of the powers that be, because of politics, because of bias that might be, you know, detrimental to the operation or evolution of you know, of resolutions. You know, I'm really curious how you all can speak to that. And also let me say to the audience, we're working to ensure that your if you have any comments, please also I think the chat might be a little disabled right now, but we do want your questions to be put in the Q&A. We'll be sure to bring them into the conversation. But yes, that question again, most promising opportunities to address these challenges, and I'll offer it up for anyone who wishes to address it first.
I mean, I think one of the promising things that we can rely on and really look back on to motivate us is just the legacy of Black women's work. You know, we've been doing this for a long time. We've made strides, and we know that when we do something that supports Black women, ultimately everyone benefits. So I'm inspired by the work of the Center for Black Women's Wellness out of Atlanta and the Foundation for Black Women's Wellness out of Wisconsin. I think it's Madison, Wisconsin. And the Black Women's Wellness Center for Wellness out of LA, and the Black Women's Health Imperative out of DC, and the Black Women's Roundtable, and, you know, the Black Women's Mental Health Institute in Alabama. I'm inspired by the work of each of these groups and the impact that they're having in their own regions, but also across the country. I would say an opportunity that exists is that in the philanthropy space, and this is something that the Southern Black Girls and Women's Consortium speaks to a lot, is that when it comes to Black women-led nonprofit organizations that are having this great impact, the percentage of funding sources that are made available to them in grants and foundations, those kind of things, is just a fraction of what other larger organizations get. So I think when we look at the work of these organizations, it's being done, impact is being made, but there's also an opportunity to support each of these organizations. And I can put some links to these organizations in the chat to really support the work that they're doing, because they are, I mean, even if I speak on behalf of our organization, it's a staff of 4. And, our free counseling program is reaching 25% of the state in a year. We have elected officials working to maybe write us into the state budget, but all of our work is supported through grants. And grant writing and that work is a lot of work to do for a team of 4. But when you look at the impact, when you look at what is being accomplished, and when you look at the fact that a small team of 4 has universities and health departments and FQHC sending people to us, that means that we must be doing something right. And I would say the same thing for the Black Women's Health Imperative, the Foundation for Black Women's Wellness, all of these kinds of groups that are doing work across the country really should be elevated and supported in a different way so that they can increase their impact and their reach.
You could not have said it better. Shout out to Linda Goler-Blount and Black Women's Health Imperative and all the other organizations that are just doing incredible work and have been doing it, and it works, right? I want to stick with you. I want to bring Ann into the conversation to talk a little bit about funders, but Nadia, talk to us about what the impact is in terms of mental health, particularly for Black women.
Sure.
Yeah, talk to us.
So I can speak specifically to our state. Well, let's take a big view, a big historical view. When it comes to health institutions and the frameworks in which mental health is understood, they were developed in a time where Black individuals, and again, specifically Black women, were a part of the conversation. So even some of the frameworks and some of the ways and the models in which medical students are still being taught aren't being taught in a way where you can really acknowledge the fact that we weren't a part of those conversations. And so there's some of the ancestral things that we've used to support ourselves, some of the things that are very unique to the Afrocentric experience that we've used to support ourselves are left out of the conversation. Our organization actually specifically pushes back against that by focusing on social justice, healing justice, and disruptive justice as a way of increasing wellness. But I also say specifically for our state, in 2015, we had about 11 psychiatric spaces close and leave roughly around 28,000 individuals without care. And that was 2015, and that has continued to happen over the year. The way our state has chosen to address that is to create crisis centers. But I will tell you now that those crisis centers reach out to us because they support individuals with crisis, but they do not have wraparound services in place for when they exit, right? So they can go in crisis, stay for 2 to 5 days, but then once they're released, there's no follow-up service and no wraparound services, so they may go right back into crisis. So there's opportunities there and challenges that exist when it comes to Black women. What we often find are community-based supports, and community-based supports may not necessarily include clinicians. And that's the work that we're doing, is really kind of getting into the ground level. It's not just saying, hey, go here for a counselor. It's going to their church and maybe setting up a satellite counseling center in their church. It's not just saying, hey, virtual services are available, because we have the Black Belt, right? And actually, one of our colleagues right now is in the Black Belt region, and we have a powerful partnership with the Black Belt Community Foundation to reach the 12 counties that are there, and they might not have they might not have the best connections for virtual services. So what does it look like for us to send individuals to the Black Belt, but also destigmatize, the utilization of mental health services? These are the challenges that we need to be supporting, but also programmatically has direct impact. But again, to kind of go back to what some of the things Ann had said, it's really policy. And that's one of the reasons why we are actually in this point now, where we're organizing with a research firm actually out of Dallas to come and do a statewide mental health equity assessment. And it's modeled after a statewide assessment that was done in California that produced policy papers, white papers that were ultimately used to educate elected officials to get them to think a little different differently about how they're allocating funds, and some kind of the programs that they're supporting. So when I think about these challenges, I think about the opportunities. I know what the challenge, I think we all know what the challenges are, but we really need to be thinking creatively and collaboratively about what it looks like to address those challenges. And when I say collaboratively, it means that if you have a white coat and you're a doctor, if you have a PhD and you have all the degrees, you need to be sitting in the room with midwives. You need to be sitting in the room with, the mother of the community. You need to be sitting in the room with the president of the neighborhood association. You need to be sitting in the room with elected officials, and everybody needs to have equal footing and equal voice in considering and thinking through what some of the solutions would be. Because if you just go, I'm gonna tell you all day long, I'm Dr. Richardson wherever I go. But when I go into the Black Belt, I am honey, sweetie pie. Okay, sugar, what can I do for you? And every once in a while, somebody's great grandmother might say, no, I'm gonna call you doctor because you make us proud. But doctor's not gonna get me in the door. I'm going to, my heart and my sincerity in wanting to incorporate them in their own solutions is what really has impact. And I think that oftentimes our institutions lose sight of that, right? They really lose sight of what it means to connect to a community and create intentional community-based solutions. So yeah, those are some of the things that come to my mind.
You gave us many very rich nuggets there, and one of them I'm going to attach on to, in terms of who needs to be in the room and who certainly, and another element of who needs to be in the room are the funders, right? And so, Anne, you do a lot of work with funders and with funding organizations. Tell us what that looks like and what is their role in terms of really uplifting those opportunities to address the challenges that you all are talking about.
Well, thank you. And I think that the work that we're doing, so I work with the George Washington University Funders Forum on Accountable Health. So what that initiative is, it's a table of 9 philanthropic funders, some national, some regional, who they have many priorities related to health and well-being of people in the United States. But the sole focus that brings them to this table is a desire to see advancement of the field of accountable communities for health. And ACHs, as we call them, is another way of saying community-based multi-sector partnerships that are bringing together the public health, healthcare, social services, other sectors, and community members. So going back to the point that Nadia was making about centering community in locally driven, designed, and implemented initiatives that are trying to work at dual levels. So we're trying to make sure that we're addressing unmet health and social needs within communities, whether that be difficulty accessing nutritious food, whether that's housing instability, whether that's tackling the maternal mortality crisis in your community, and then also making sure all the discussion, I have to shout out Daniel Dawes too, right, that we're addressing these upstream drivers that are leading to the presentation of the conditions that show up and manifest through screening tools that a social worker has or that a doctor or a nurse has. So the funders include, we work with Robert Wood Johnson Foundation, with Commonwealth Fund, with Kresge, with Kellogg. There's a lot of great work going out in Texas. So we bring in Episcopal Health Foundation, St. David's Foundation. California has an initiative that was recently expanded. So we've got California Endowment, Blue Shield of California at the table. And then finally, we've got interest on the part of North Carolina and the Blue Cross Blue Shield Foundation, North Carolina. So, this work and what these funders care about is, I think, exactly, Nadia, the point that you're making, right? The solutions and what we need to do, we must center community and identifying what needs to be done and then actually doing it. And I did just want to pull up in terms of, where I am optimistic and excited. This work that we're talking about and the importance of supporting CBOs is thematically called out as a key pillar of the White House's recent, they put out a U.S. playbook on social determinants of health in November. So it has 3 pillars. It's focused on data, the importance of information. We need to know where the gaps are so that we can actually address them. The second pillar that it calls out is the need for flexible funding so that you can put together different pots of money to do things. And then the third pillar is direct support of CBOs. So I think I'm very encouraged and excited to see a strong statement from the federal government about the importance of this work. And I just have to go quickly like to a different topic, and I know we'll get into this more, but another thing just in the vein of things I'm very excited about coming from the federal government, the president last night during a State of the Union address talked about, proposing and putting some resources behind this national women's health agenda. He gave the figure of $12 billion in his speech. So I'm encouraged about what that could mean with funding for women's health generally, but then specifically within that, thinking about the particular needs and opportunities for Black women.
There are a few things that I want to make sure we put a pin in, because we do need to talk about ARPA-H and the Advanced Research Project Agency for Health, and specifically the Sprint for Women's Health. We need to talk about, I want to bring Dr. Lawson into this conversation, Dr. Lawson, to raise up some of the challenges as well, the opportunities that you see to address these challenges, not even just in your role as a provider, direct provider, but you own your own practice. And what does that mean in this environment? What works, and how is your work really really mattering in this realm?
Thank you for the question. So one of the most promising things to me is that there's just more awareness. I have never in my entire career heard more around health equity, lifting up around the awareness around disparity. So for me, that's just the awareness piece, right? It's not that, when you look at maternal health inequities, it's not that that hasn't existed, but I still, just last month, a woman, I was in the elevator. She said, I just really didn't know Black women died more often. But we know that's existed ever since the record keeping began. But again, the awareness is driving, right? Focus, initiatives, campaigns. And so one of the things I think Nadia and Ann brought it up was around collaboration. I have found during this presidency, that's probably what's working most effectively for me. And I think through that lens of any initiative or thing I want to do. So one thing this spring I'm planning is to convene all of the major Black healthcare organizations. Black physicians, dentists, pharmacists, nurses, registered dietitians, physical therapies, thinking of this in an interprofessional, multidisciplinary lens. And what I'm really working on is formalizing the Black healthcare agenda. So what is frustrating is that, policies, rules are put forth, healthcare workforce is frustrated, right? And so even for me, being a practice owner, the impacts of consolidation, that is having long-term impact on the workforce. And so part of the work of the NMA is the diversification of the workforce. So workforce is another pillar. I have 3 pillars. That's my second pillar. You've heard me talk about the Black women's health agenda, workforce, and then the third is around digital innovations and how do they close the health equity and the disparity gap. But these workforce issues are important. We have a lot of things coming into play from a population health aspect that are coming to play in this country. And probably one of the number one that I'm probably most focused on is the aging population. So here we are looking at by 2035, there will be more older Americans, people over the age of 65, than children for the first time in history. There is an aging population that has downstream impacts, workforce, cost, right, budget. And so even if from an employer standpoint, when you think about large employers, what's going to happen to their workforce? What happens to the demographics of health conditions and where should we be focusing on? So large, broad impacts. And so for me, collaboration, I think Ann said that, I think Nadia said that. And so I agree. And I'm looking at what that looks like between other organizations, right? And so I started doing a spreadsheet on who does the NMA collaborate with, links, and all these other people that and entities that we can push forth the agendas, whether that's on health education, whether that's on prevention, and then also how do we really work together to create diversity within the entire workforce for healthcare.
Your pillars are powerful and timely, Dr. Lawson, and your leadership is certainly something that's heralded with respect to providers and specifically here with respect to the NMA. So thank you so much for reminding us of that work. And I want to bring, you said something about you were talking about collaboration, and when I think collaborative efforts, it's really hard not to think of you, Millicent, and not even just in your current capacity, with the Alliance, but throughout your career, So same question to you, what are those most promising opportunities to address the challenges that you've mentioned? And you're speaking to us specifically about obesity, but then can you also speak to us about the role of collaboration in your career, in the work that in the problems that you set yourself out to be a part of solving?
Thanks so much, Mia. So collaboration is key, and I just want to throw this back to Dr. Lawson, that there was a thing called the Black Congress on Health, Law, and Economics. As young as I am, I was the grandmother to that group from many years ago. And I think it's wonderful that you're planning to pull all of these organizations together. I think it's a powerful force, particularly in an election year. And I'm hoping that once we get through this election year, that you will continue to do so 2 years out to make sure that we can continue on with the good work from a political and electoral process. Collaboration is key for what we're doing in terms of the opportunity around obesity and trying to make sure that women can get the best comprehensive obesity care. We are in collaboration with organizations like the Black Women's Health Imperative, the American Medical Women's Association, and Healthy Women. And so we're excited about all of what that portends, because one of the opportunities is to get the Treat and Reduce Obesity Act across the line. That bill has been in Congress for 10 years. It impacts Medicare beneficiaries. Medicare does not provide for anti-obesity medications at this point. So that means that all of us who are in that golden years, our mamas, our grandmamas, our aunties, our best friends, even though they may be working or may not be working, they cannot get access to anti-obesity medications through the Medicare program. So that's one of the pieces that we're hoping to get through. And then there are 16 states, only 16 states, that provide some level of obesity care and treatment. And so we're looking to get all 50 states. So we're having these kinds of conversations and getting the women to have conversations with their elected officials back home around obesity care, and then also for state employees. And so it's all about collaboration, as many partners as we possibly can, to open up the dialogue and for them to understand that when we're talking about obesity, we're talking about cardiovascular disease. If you care for maternal health, you're talking about obesity. If you're talking about cancer prevention, you're talking about obesity care. So we just want to have those kinds of crucial conversations with as many organizations and people as we can. All of those wonderful funders, Ann Reed, they need to be a part, and some of them already are a part of that conversation. And I just think that it's important for all of us to take a look at where we are across the continuum, to have collaborations and help these women, Black and brown women, live their best lives. That's what I'm trying to do, to help them live their best lives.
I just wrote a note here.
If you'll allow me, Mia, I'd like
Please.
to address something that she just said.
Yes,
So the day after King Day, the presidents of most of the Black organizations, even outside of healthcare, we began to meet. So the National Bar Association, National Business League, the Black MBA. So we have really been working around what is the Black professional agenda. We are all highly and keenly aware we're going into an election year, and we all are mutually aligned on a few things, that we want to see policies that are positive and beneficial for communities of color. And secondly, after the SCOTUS decision last year, we're all worried about the Black professional pool, all right, around education, getting into graduate school and higher education and postgraduate. So we're all aligned. We have been meeting and we have discussed bringing back the Black Law, Health, and Wealth Economics Forum. So we're working on it, and it's just, again, there's collaboration, and it's just really trying to push this forward, because again, I have a sense of urgency around this. Thank you.
Thank you.
Definitely a sense of urgency. And Dr. Lawson, put us to work. I have a follow-up question for you, Millicent, but I think you were about to say something else.
I was just going to say one other opportunity is around cervical cancer guidelines. We're anticipating that the U.S. Preventive Services Task Force will be bringing up their guidelines. They come up every 5 years. We're hoping that the guidelines, and what we're going to be advocating for, is making sure that HPV and Pap tests are done at the same time. They have the most sensitivity done together. We're really hoping that more African-American women and Latino women are able to get their cervical cancer screenings done on time by the right provider, and making sure that we can cut the rate of cervical cancer deaths. We're also hoping that in terms of HPV, that we can increase the rates of the HPV vaccine. We know that it starts at 9 years old for girls and boys, and we're hoping that everyone up to the age of 45 will be able to get their HPV vaccine. This is a disease that we can hopefully eliminate, and if we could help do that by getting the HPV vaccine and the screenings.
It's a curable situation, right? And unfortunately, this is definitely something we have to elevate for sure. I wanted to follow up. There are 2 questions that are specific to obesity that I wanted to give to you, Millicent, specifically weight reduction drugs, tax on African-American women. Do you have any information to share with the audience on studies around weight reduction drugs by chance?
What our Everybody Covered campaign is hoping to do, Mia, is to make sure that women can get the full continuum of care, and that includes the anti-obesity medications, along with surgery, along with physical activity, along with intensive behavioral therapy, along with nutritional therapy. So we want to make sure they can get the entire continuum offered to them.
I think that's exactly the way to go. Is the continuum. What about for any of you with respect to, we didn't speak so much on clinical trials, right? But most people, and Dr. Lawson, correct me if you're seeing something different. Most people come to learn about clinical trials through their providers, right? And so I'm wondering, and there's someone in the audience wondering, is there specifically a space where people can go as a Black woman and just get hooked into clinical trial networks? What I will say is shout out NMQF. If you want to ask more questions about clinical trials, you are certainly in the right place, but I will also open it up in case anyone else wants to address this question.
I'll just chime in briefly. So it is an issue. I know there are even some technology companies, right, that are taking this on about access to clinical trials. If you live in jurisdictions where there are county hospitals type of thing, or university or academic centers, it's very important. A lot of times they have requirements, they have to post it in the newspaper or wherever. So their sites are very to go to, but you're right, many would be through your clinician, because there are eligibility criteria. There are certain criteria that, right, you got to qualify for a trial. As far as there being anything that's specifically that I'm aware of, specifically just for Black women, there are entities regionally I'm aware of, but I don't know if I could speak to that broadly. At the NMA, we are currently actively doing that work, working on aggregating who and where are our Black researchers in this country, working on increasing the path to become a researcher for Black, right, physicians or scientists, also working to increase engagement and enrollment, right, of Black people from the community perspective. And so we're actually working on a database now to begin to aggregate that. My hope and dream is that we can create a resource hub, because people definitely need it. You know, historically, it has been challenging, right, for many clinical trials to have representative numbers of Black folks engaged in the trial. So we know that last, when the FDA, their Enhanced Equity Initiative was laid out, we know that there have been attacks against that. So many of Biden's equity executive orders have been attacked. And so we know that that exists. So, but it doesn't preclude us from continuing to do the work, because it's definitely, we have recognized the need and something we're actively working on to roll out at this time. Thank you.
And I would like to highlight, there's a Black-led startup company here in Birmingham, Alabama called Aclinade. It was started by Del Smith, and they are specifically looking to increase diversity in clinical trials. But what I appreciate about their work is that there is a lot of community-based engagement as incorporated into their reach, but they're also holding companies accountable for being equitable in their practices. So it's not just increasing diversity to get diverse individuals to participate in clinical trials. It's making sure that the individuals who are hosting and facilitating those clinical trials are being equitable in their dealings with the community. So that's a company that might be worthwhile for looking into, Aclinade, and it was started by Del Smith.
You can drop that in the chat.
Sure.
That would be great. I know there are a number of specific subjects that we've not covered in this very fast hour, almost hour. I don't know where the time went. I feel like I've been sitting at a dining room table just chatting with you all about the work that we are part of. And I truly appreciate everything. I have two final questions for you. Well, really one big one. This is, we're talking about the challenges as well as the promising opportunities to really address challenges with respect to women's health, and particularly Black women's health. What are some of the things that you all do to care for yourself, and who did you learn it from?
I'm happy to go first on that one. So I have to say, especially with Dr. Watson on, I can't not say this. I'm the I'm the granddaughter of an orthopedic surgeon who was a longtime member of the NMA back at a time where there were even fewer doctors in this country. I'm the granddaughter of a nurse who went back and got her master's in public health in her 50s. So in terms of how I've learned to think about these issues, certainly on a professional level, my grandparents were hugely influential in my life, but also just role modeled, the importance of family as a core anchoring point in keeping things in perspective, the importance of faith and spirituality and how we carry ourselves and keep going day to day and try and find compassion and empathy. So I would say, for me, my family, my parents, my grandparents, in particular, were just hugely influential, shaping me. And I'm just very fortunate and grateful to have a supportive partner, wonderful kids. So family is really core.
And if I can add on and just be completely real on this beautiful Friday, is that individuals who are doing the work that we're doing and promoting wellness and promoting balance and promoting self-care and all those things tend to be the biggest hypocrites, right? Like we are not doing this for ourselves, not often, right? So what I would say is that there are some days that I stop, I rest, I tap out, I go on vacation, I sometimes just stay home, whatever I have to do, I do it. And then there are other days where the work has me going, and the passion and the commitment and the need, it has me laser focused to where I'm giving and giving and giving. And what I believe keeps me in those moments is a circle of women who know how I work, right? And then I can be that to them. They know to check in, and I check in on them. They know to hold me accountable, and I hold them accountable. They know to, and I'll give you a perfect example. We hosted our women's Our annual Women's History Month luncheon last week, Friday, was phenomenal. We had the mother of Chesley Chris, if some of you may remember her, Miss USA 2019, who was lost to suicide. Her mother came and spoke. It was this really great, beautiful, healing mental health space. But whenever I host an event, whether it's that or our annual conference, the Mental Health Equity and Liberation Summit we host every summer, I'm working so much that I don't eat. I just don't. Like, I'm working, I'm running, I'm working. And at this point, having done this so many years, I had 3 people at our luncheon fix me a plate because they were like, she's not going to eat. She's not going to do it. So they literally, and I laughed, and I actually said it when I got up to the podium, and I was like, this is what sisterhood looks like sometimes. When somebody's laser focused on their purpose, on their passion, they might not necessarily always stop and say, oh, I need to check in with myself and take care of myself in that moment. But the people who see them and support them will do that for them. And I do the same things with friends, Mia, who are working on their doctorate. I do those same things to make sure I show up, because I remember that same circle. There's a group text I have right now with a group of women that I went to graduate school. And I can tell you at working on our doctoral degrees, at any given moment, one of us was like, I don't need this. I got my master's. I'm good. I'm just going to get a job. Right. And then we were able to pull each other back. And so even now in our various professions, we're checking in on each other, and we're supporting each other, and we're speaking each other's names in rooms that we're not in. That's all care, and that's all support. And I know that that sustains me. And I hope that I am able to sustain others in those ways. Because this work will, it will wear you out. Like, racial battle fatigue is real. Like that whole Dr. Claudine Gay, Harvard situation. Multiple women on my timeline were like, I'm exhausted because I know what this feels like. Or when Antoinette Bailey at Lincoln University was lost to suicide, a Black, higher ed administrator. Women who are working in those spaces know what that feels like. And that's exhausting to be in spaces where you're not supported and where you're trying to promote equity and justice and wellness and all of those things, specifically in the space of health disparities. We need each other. We need each other. This space and what y'all were able to do and just bringing everyone together for this conversation is healing. This is self-care for me. This is beautiful to hear and support and listen in on women who are committed, and who celebrate themselves and the work that they do and believe in the work that they do as healing. But I also think that we need to have grace for ourselves in those moments where we're not necessarily walking the walk, like when our talk and our walk don't align. We need to have grace with ourselves and say, okay, in this moment of busyness, I might not have been all the things that I am encouraging other people to be, but I can be in this moment, and that's okay.
Love it. And she's right. She does text me, hey girl, what's up? What are you doing? How are you doing? I appreciate you, Nadia. Millicent, how do you?
Mia, mine is for the legacy, for the folks coming behind me. So yeah, I'm one of those fluffy people that I talk about, and that's why obesity is kind of a passion for me right about now. But I'm also concerned about my mentors, my nieces, the women who are young women who are coming behind me. So I am writing a letter. I write letters. I've been writing letters to one of my college big sisters since 1971.
I know, and you told me to
letters.
go find her in Martha's
in
Vineyard,
Martha's
and I
Vineyard.
did.
Yes. And so I am writing a letter. I talked to one of my nieces and I said, you know what? I don't want you all to have the same kind of diseases that I'm living with right now. So we've got to stop doing what we're doing. We've got to change habits. Both of you are running around the countryside. You're on and off airplanes. You're staying late for school board meetings, of which my niece, Miss Millicent, I'm really happy about, has won her seat at the Durham Public Schools as another 4 years as a board member. But I need for them to take care of themselves. I need for them to do all the kinds of things that we're talking about. Stop and take the time to go to the spa. Stop to take the time to pray. Stop to take the time to check in on our friends, particularly our girlfriends. And one of the biggest issues now is isolation, and we tend to work so hard that we forget about ourselves and that we need that hug, that we need that that laughter that shakes us all the way to our bones. So I am hoping to take advantage of that. I'm just going to say this one thing, that I received a wonderful gift that I have not used to go to Salamander, and I am going to take advantage of that very, very soon and get my own self-care started soon.
Woman-owned, Black-owned resort all over the country
Absolutely.
and outside the country. So look into them. Dr. Lawson, please close us out with a strong word here, as you always do.
So you all know I struggle. I'm glad you called on me last, because I was like, I hope you skip me. We just skip me altogether. But I literally, I find myself having to fight. I have to fight for my time and my space. You know, getting here this morning, I told you I was knee deep in fibroids this morning, doing a hysterectomy, trying to make sure that folks are okay. So it is challenging, but I have to say I do it. It's family, it's my circle of friends, and those people that check me, right? I have to be checked almost every month because when you're committed to the work, you're trying to do the best. There are also many demands on us from so many different places. Sometimes I feel like I don't have a place to go. And so I agree, this speaking and being here with you all, hearing about what you're doing motivates me, gives me light, makes me lighter. But it's challenging, but it's so hard because you said, all day I'm telling people what they should do, and I have to look at me and myself and what I'm doing to protect life, because I grew up in a community. I'm from rural Arkansas, and all I saw is that as people got older, they suffered. And I saw a lot of suffering. And so all I know is that from what I've seen, I know I don't want to live down that path, right? Because there becomes a psychology to this that you begin to wonder, right? And so I know that for me to pivot and change legacy and generations, I have to live differently, and I have to be differently, and I have to think differently. And so, but again, I'm so happy to be here with all of you. I've learned from each of you today. I've been taking my own little notes on the webinar, and just happy to have this space and this time with you all.
I could not have said it better. Thank you all very much for being here. I know we are over time. I'm just going to take full advantage and ask for forgiveness later from NMQF, but I won't excuse myself, at least from this question, right? So Millicent knows, Nadia knows, but I'm a solo parent to a very active boy toddler, and he wants mommy at her best at all times, whether I'm an airplane or a WWF wrestler or just a cuddler. He wants mommy at her best. But I'm also a student, work full time. I'm a daughter, a sister, a friend. And the way that I really try to, and it's hard, it's very hard. It can be frustrating, but it's so very plentiful. And I lead in gratitude, but I also require village. The village has to show up, and not just because I have a child. I mean, certainly now that I have a child, but the village must show up in order for me to be my best. And that I am not, my best varies from moment to moment. And that's for everybody. Everyone's best varies from moment to moment, but the pledge I make is always do your best, always do your best and show up in the spaces where you're really very invested in helping to be a part of the solution. And if not getting directly to the solution, at least just elevating. And so I certainly give you all, once again, as I started, I send you warmth, I send you energy to continue doing what you're doing. I'm very proud of each one of you, and that goes for people who are in the audience as well. Stay surrounded, and thank you so very much to the NMQF. Thank you, Dr. Yolanda Lawson, Dr. Nadia Richardson, Ann Morris-Freed, Millicent Gorham. You all have been fantastic. I'm Mia Keys. I hope you all have a fantastic weekend. We'll see you another time.
Thank you.
Thank you.
Thank you all.